This is a very interesting trial to be discussed because what we have evaluated was the efficacy of use of Opicapone, that it's a new COMT inhibitor for the management of Parkinson's disease patients, but patients without motor fluctuations. Opicapone, it's a COMT inhibitor, and COMT are licensed for the management of Parkinson's patients with motor fluctuation, and its use in patients without motor fluctuations, it's an off-label use. I would say it's an hypothesis that had already been studied with entacapone and with tolcapone, but this is the first trial using Opicapone. In this trial, so we have evaluated if Opicapone adjuvant to levodopa compared with placebo would generate an increase in terms of improvement of motor impairment using the MDS-UPDRS Part 3 as the primary outcome. And in fact, after 6 months of follow-up, the trial is positive. So Opicapone adjuvant to levodopa is more efficacious than adding placebo in patients without motor fluctuations. What I have shared, again, in this Congress was also the results of the extension period. And the results are very interesting, not just because they document that the risk that we were in some way anticipated of aggravating motor fluctuations and dyskinesia by the use of a COMT adjuvant to levodopa, again, did not occur. In fact, the patients that were initially treated with placebo had more frequent reported dyskinesia and motor fluctuations, and after 1 year, so patients had one year and a half of follow-up. Not just the patient that started on Opicapone first were still better in motor terms, but also they had less dyskinesia and less motor fluctuation. This is, in some way, it's a very important information because it opens the hypothesis that using COMT inhibitors early, even in patients without motor fluctuation, not just generate a gain in terms of, improving motor impairment, but also the hypothetical risk to aggravate dyskinesia and motor fluctuation need to be resynced. And clearly this is something that at least after 1 year and a half we did not found. So the safety and tolerability profile seems to be much better than what was anticipated.